Good morning, I'm Rosalie. Today we'll feature new advances in healthcare to manage pain, how to protect ourselves from influenza by getting a vaccine now, and health and wellness benefits to take that earned vacation time away so that we can open our minds, eyes, and heart through inspiring new life experiences that will recharge our lives to be our most creative self when we return. Did you know C-sections are the #1 surgery in the U.S.? Each year, 1.3 million pregnant women deliver their babies by C-section. There's been many advancements in women's health care, but not in childbirth and major surgery like C-sections. Truth is, there's been a lack of major breakthroughs in pain management for women since the 1980s when the epidural became common, leaving new mothers with opiates as the only choice to manage pain following a C-section. Mothers need to deal with pain while trying to bond with their newborn. When pain is not properly managed, it can interfere with a mother's ability to care for herself and her baby, resulting in impaired ability to bond and breastfeed. Fortunately, now there are effective non-opiate options to manage pain after a C-section delivery. Joining us this morning to highlight advances in opiate alternatives is Dr. Elizabeth Chereau, expert in obstetrics and gynecology. Good morning, doctor.
Hi, Rosalie. Thanks for having me.
My pleasure. Dr. Childbirth is often the first time a woman is exposed to opiates or other pain medications. Tell us, what do expecting moms need to know about C-sections and what happens after the surgery?
I do think in my practice it's something we have a discussion with starting at 36 weeks about pain control after surgery and what alternatives there are. Women, if they can have an opioid minimizing procedure, will absolutely, like you discussed, having breastfeed better, be able to move about better, get up to the bathroom, less constipation, less side effect. The opioid isn't in their breast milk. It really is a better type of procedure.
So can the opiates infiltrate the breast milk? And how will that affect the infant?
Yeah, infants can absolutely be drowsy, have difficulty breastfeeding. So if we can minimize that, we try to. So in my practice, we use a long-acting numbing medication at the time of closure of the C-section. We actually put it right into the incision, just like you would in a dental procedure, have long-acting numbing medication. And so patients will also use Tylenol and Motrin for their pain control afterwards.
Wow, that is amazing. So how do you envision the new standard of care for women? And what should we aspire to?
Great question, Rosalie. Listen, we believe that at Axia Women's Health that women deserve more. They should have that conversation with their provider, discuss their different options, be able to have choices and advocate for themselves and be able to have an open opioid minimizing procedure.
Before the interview, we were talking and you said you regularly use a non-opiate medication to help women. So how does that effectively combat the pain?
We do. We actually, it's been used, Exparel's been around for, I don't know, since 2012. Over 6 million patients have used it. In my practice, it's standard to use for any C-section to use it at the time of closure, as I said. And we really try and encourage patients to take Motrin and Tylenol afterwards. I haven't prescribed an opioid in months. I no longer walk around the hospital with my prescription as it's not needed. And that discussion starts roughly at 36 weeks, but I encourage all women to talk to their patients about it.
So you have this conversation with your patients and you discuss pain management options. There are so many side effects to pain meds. What are some key benefits of utilizing non-opiates for moms-to-be? And how does that impact their recovery?
Sure, surgery is painful. We need to be able to manage that patient and be able to it's never going to be painless. It needs to be managed well. It needs to be a shared opportunity to have that conversation with that patient. We don't expect the patient to be, like I said, to be painless throughout the procedure or after, but it should be a joint decision about what prescriptions are needed.
And opiates can leave you with that edgy feeling that affects a mom's responsibilities. If she has others to care for at the same time, it can upset the entire family. All members can be upset, right?
Yeah, I mean, think about it, feeling a little bit dizzy, maybe a little bit out of it, not being able to make decisions for yourself, and being groggy and tired when you're up all night taking care of a newborn. That additive opioid, if you could avoid altogether, imagine your recovery without that.
So how has the opiate epidemic affected your area of medicine? You say you don't prescribe opiates anymore.
Yeah.
And is this the norm in your practice?
Rosalie, in my practice it is. We really don't. I would say we've reduced our opioids by 87%. I would say over 70% of my patients go home with no opioid prescription at all. They're able to take Motrin or Tylenol. They're not bringing home that opioid prescription, that they themselves would take, or God forbid somebody else in their family would take. So to avoid that prescription altogether is really our goal.
One last question, doctor. Are some patients more prone to get addicted from opiates than others?
I'd have to refer you elsewhere. I haven't studied that in detail. I would say to you that every woman has a pain score or a comfort level or discomfort level with surgery. I really encourage patients to go to csectionpain.com and download their guide and have that frank conversation with their patients.
All right, thank you, Dr. Chereau, for sharing advances in pain management using opiate alternatives for C-section surgeries.
Thank you.
It's always a great time when family and friends enjoy activities together to create future memories. But one thing is for sure, when kids play with their playmates, they bring home germs and illnesses, shared from playmate date to a trip to a nature park. Germs are everywhere. Even when we're playing in our own backyard with friends and pets, we bring those nasty germs into our household. So how can we avoid spreading disease? Well, Michelle Helavasa is an epidemiologist at the Center for Disease Control, and she's here with some helpful reminders that will help stop spreading disease.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great! No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy.
For more information, visit cdc.gov/hand washing. All us Floridians are very vulnerable to a variety of viruses that are left behind from U.S. and international visitors, including the flu. Influenza activity runs from December through February and into May. While the CDC urges the public to get vaccinated by the end of October, experts agree for those who haven't got their flu shot by the new year, it's not too late to get a flu shot now, especially for groups who are at increased risk of flu and flu-related complications, like adults 50 years of age and older, and people living with chronic medical conditions. Joining us this morning is JoJo O'Neill, Orlando radio personality and asthma sufferer who dealt with an extreme bout of the flu, and Dr. Payal Gupta, American Lung Association volunteer medical spokesperson and expert in infectious disease, to discuss the importance of getting a flu shot now. Good morning, ladies.
Good morning, Leslie.
You know, JoJo, as broadcast talent, we need to stay healthy and energetic to keep our lungs in tip-top shape. So share with us the dangerous experience that you had living with asthma and then getting the flu.
Yeah, that was a double whammy, and you combine the two, and it's very scary. Asthma in and of itself is tough to deal with, but I developed flu. I had never experienced anything so awful in my life. I had severe body aches. I had nausea. I had fever, chills. It took me out of the game. I missed out on a lot of my personal appearances. I missed out on work. And on top of that, had to then think about, okay, how is this going to affect my breathing? And then had to think about other people besides myself, because I did end up infecting my sister and her daughter. Then I began to think about sharing that microphone in the studio with my coworkers. How had I affected them? Thankfully, I had not affected or infected my coworkers, but I did with my sister and her daughter. And so that really is what prompted me to join the American Lung Association and get in on the My Shot campaign to encourage others to get the flu shot and not experience it first like I did. I don't want people to have to go through what I went through. I want them to go ahead and get that flu shot and feel better about it, especially if they're in that over 50 age category and with a chronic condition, in my case asthma, or perhaps COPD or diabetes or heart conditions, so that they can just make sure that they're healthy.
Dr. Gupta, about 70% of adults 50 years of age and older have one or more chronic illnesses such as heart disease, lung disease, diabetes, and cancer. So as an expert in immunology and respiratory health, how do you stress to the public to take ownership of their own health risks and ask their doctor about the flu shot options that may be right for them?
Yeah, so it's absolutely right. Those people that have those chronic health conditions are at higher risk of serious complications and hospitalization and even death from the flu. And so, I just encourage everybody, and that's really everybody, to get the flu shot, but especially those over the age of 50, because it can protect you, because the vaccine is so effective at preventing those hospitalizations and those deaths. So really, it's just that everybody should be getting the flu shot, especially those over the age of 50 and pregnant women and younger children.
Like JoJo just said, she was concerned in the studio about her spreading her germs. It's tough to keep your distance in a studio setting or an office setting with lots of people around, not to mention shaking hands while you're trying to do business.
Right, so it is spread person to person, and it is spread through droplets. So if someone sneezes, coughs, or if someone touches something, then you touch it, and then you eat something. So it really is person to person spreading, and that's why it's so important to do what you do. You protect yourself. People that are coughing or sneezing should cover their mouths, wash their hands, and especially get their flu vaccine, because that's the number one thing that we can do to prevent the flu from spreading, is get our vaccine and keep our body protected so that that we can protect those around us and prevent complications. And we know in Florida, we've already seen 4 pediatric deaths from the flu this year. So, and nationwide, we've seen 6,600 deaths. So it's not a small thing, and we really should take it more seriously and protect ourselves and protect others around us.
So if someone has a respiratory condition, COPD, or prone to pneumonia, are they more at risk to the flu?
Absolutely. So it is a severe respiratory illness. So it's really the number one place that it affects is the lungs. And so if you do have asthma or COPD, we know that that makes those conditions worse. It can also actually, though, worsen cardiovascular disease. So we've also seen a link between getting the flu and having an increased risk of stroke and heart attacks. So again, having any kind of chronic health condition really puts you at increased risk of having those serious complications. And as you mentioned, over 70% of individuals that are 50 years and older do have at least one or more chronic health conditions.
So Jojo, because you caught the flu, you got involved with the American Lung Association and the My Shot campaign?
Actually, I was already doing some work in advance. I have my own nonprofit organization called the Let's Kick Asthma Foundation. We educate about how to live better with those symptoms and to overcome them and handle them better. So I already had an affiliation with the American Lung Association and dealing with people who have lung issues, but it really just encouraged me to go in that direction and say, you know what? Since I have this organization and I'm a spokesperson, let me also join in this particular campaign about the flu shot, because now guess what? I developed it myself and it is no joke. A lot of people sometimes think, and I was one of them, that the flu is just a bad cold. And it's not. It's so much more severe and so much more serious. And so that's why I joined in as a spokesperson, and I really found the website to be helpful as well. There's a lot of good information out there. There are also other personal stories of people dealing with flu in addition to my own at getmyshot.org.
So doctor, how do we attribute that children result in pediatric deaths from the flu? Why are they at risk?
So it really is younger children, babies, infants, toddlers also have a compromised immune system. Pregnant women also have a compromised immune system. And then again, anyone over the age of 50. So all of those groups are at higher risk. And so that's why you do see often pediatric deaths, unfortunately. And if everybody gets vaccinated, then we can prevent those deaths. Because if you protect yourself, you're protecting those around you, as we've already said. So it really is herd immunity, meaning like we're protecting each other.
So doctor, tell us why you recommend that people who have not had the flu shot yet to go get one now.
Absolutely. So, we know that the flu season peaks between December and February, but as you said, it can go as late as May. So it's not too late to get your flu shot. Get it today. It takes about 2 weeks to develop those antibodies, and that's why we really need you to get your flu shot today.
All right, so where can we get more information?
Getmyshot.org.
Thank you, Doctor and Jojo, for joining us this morning to increase awareness of the importance of getting a flu shot into the new year.
Thank you so much for having us.
Did you know Americans throw away 25% more trash during the holidays from Thanksgiving to New Year's than any other time of the year? The extra waste amounts to about 25 million tons of garbage, or about 1 million extra tons per week. Now, for an average individual, we create about 710.6 pounds of recycled garbage and 1,361.4 pounds of trash that we toss out every year. And that's about the weight of a grizzly bear. It's time to rethink what we recycle and reset our behavior. By eliminating 30% of contaminated materials in curbside recycling bins, Florida taxpayers could save $100 million in recycling costs in just 1 year. You know what the problem is? It's wish cycling, or well-intentioned recycling that causes more problems than solutions, like contaminated recycling bins with items not meant to be there, such as food, plastic, bags, clothing, or tangled items. So what can Floridians do? Stick to the basics. Make sure each item is clean and dry before going into the curbside recycling bin. When in doubt, throw it out. Avoid recycling these items at curbside. Spread the word. One of the best ways to make an impact is by helping those around you understand the do's and don'ts of recycling. So rethink, reset, recycle at floridarecycles.org. Time off is essential to a person's overall well-being. Strengthening personal relationships and improving professional performance is important. And the truth is, vacation promotes overall health and wellness. Joining us to inspire new travel experiences and increase our human connection with those outside our day-to-day world is on-air travel host, storyteller, and executive producer, Michaela Guzzi. Hey, good morning, Michaela.
Good morning. It's so nice to meet you. Thank you for having me.
My pleasure. Michaela, we are so busy, all of us. We have work responsibility, family responsibilities, and we forget life is short and there's no better time than now to plan a new life experience. Is there an easy way to encourage our viewers to pay attention to their life and take those vacation days to plan a new life experience?
Absolutely. Well, we all know the positive benefits from taking a vacation and just taking some time off. It allows you to disconnect and from all those digital devices that you are and reconnect with yourself and your family and loved ones. It reduces stress and anxiety, and who doesn't come back from vacation happy? So I was really excited. January 28th is National Plan for Vacation Day. And one tool that I came across that I absolutely love, Norwegian Cruise Lines have 17 ships that sail to 300 destinations across the globe. And so they've come up with this fun little quiz on ncl.com. You go, you answer a couple quick questions, and then they tell you based on your response, the type of traveler you are and which itinerary and destinations best suit what type of trip you should go on. So it's a fun, easy way to navigate all the endless options.
Michaela, share some travel tips that will help open up the communication at our destination when we meet people we've never spoke or interacted with.
Absolutely. Well, one of my biggest trends for 2020 is not only human connection and finding those ways to immerse yourself in a destination and with people that you're meeting, but also experiences and not stuff. And so when you are digitally disconnected and out in the world and having these life-changing experiences, I think you're also more open to meeting new and different people. And some experiences that really stood out for me that NCL have on all of their various itineraries across the globe. I mean, one, they're going to be sailing the newly refurbished Spirit to Tokyo, Japan during the Olympics, which is pretty cool. But then that's contrasted by, in the Bahamas, they'll even take you to go out swimming with pigs. How cool is that? So literally such a range of beach and swimming and tropical destinations to these new itineraries that they'll have on Spirit going to the Middle East, Africa, and Asia. All can be done online, or again, to help you navigate, you can call a travel professional who really knows those destinations in advance. And Norwegian takes all of the work out of it for you. So it's not like you have to plan the ins and outs of getting there. The logistics are taken care of.
For those of us here in Florida who want to take 4 to 5 days off for a cruise, there's options.
Absolutely. Leaving from Florida, your options are quite literally endless. I know the Encore is sailing from Miami to the Eastern Caribbean through April. And one of my favorite itinerary stops that they have is to St. Thomas. And St. Thomas has 2 itinerary stops that I'm like so excited for. One is you can take a catamaran to go snorkeling at a shipwreck, or you can go swimming with giant sea turtles. I mean, talk about a life-changing experience. And those are memories that'll last a lifetime.
How has the travel industry changed worldwide?
Well, the travel industry is evolving at a rapid pace. I mean, more and more people are on the road now than ever. Americans are traveling more. People are going on more trips and shorter haul. So what once seemed so far away, people are picking up and going to Bali now. People are really digitally connected, which is both a good and a bad thing. It does open you up to what's going on around the world, but then also we're super connected to our phones and all our devices, and we need to rest and recharge, as we discussed before, so that we can be our most creative and productive selves.
But sometimes it's hard to disconnect from our devices. It's an extension of our personality. We're stuck there. We've got to look and see what's going on.
Absolutely. I don't like it, but I would agree with you. The good news is, I mean, while there is quite a bit of connectivity on board, there are certain destinations where you might be without Wi-Fi for a little bit or not the strongest of connection. And I urge you to take advantage of that and just see how much more productive and creative you are when you come back.
Yes, and when we travel, we learn about new cultures, and we have real life experiences that have never been duplicated.
Yes, absolutely. I mean, travel opens your mind, heart, and eyes to the world around you. And I think you are more inclined to talk to some people that you met on board or maybe at a restaurant in a different destination. I mean, one of the things that I like about this Spirit is they're adding 10 new ports of call to places they haven't stopped in before. And some of them are even overnights in some pretty iconic destinations like Kyoto, where personally, I did a dinner with a geisha, and you can walk through the streets of Kyoto, and there's the Golden Palace. There's so many wonderful things, including the food, to experience. And when you can really take that time and explore a place, I think that's when you're truly transported.
Yes, and you just transported us in this interview. I'm ready. Thanks, Michaela, for joining us to inspire our viewers to use up travel days off and plan a new life experience.
Thank you so much for having me. Ships ahoy. Hope to see you on board.
I'd love to take the time off.
Bye.
Thank you. This month, we can celebrate Inspiring Days, Valentine's Day, and National Random Act of Kindness Day. So get creative and take time for a new life experience that will make future memories. Share with us how you created a loving and kind new life experience at facebook.com/Rose Lee Show. And follow us on Instagram at The Rose Lee Show. Watch this episode and many others 24/7 at roseleearchershow.com. And thanks for joining us this morning, and we do look forward to seeing you soon.